circumstances, if you register any symptoms at all, please come forward and get tested. We will support you. We will get you your results as quickly as possible. Hopefully they're negative and the scratchy throat or the cough or the symptoms you're experiencing are not COVID, but you will have played such an important part in our collective struggle against this global pandemic, against this virus. Arguably, getting vaccinated will be our way out of this in the long term. Getting tested as soon as you register symptoms is our way of getting out of this in the short term. And on that basis, we again ask anyone from across the state with any symptoms, please come forward and get tested as soon as you register those symptoms. In particular though, and when Kate takes you through some of the cases, it'll become clear that there are further cases in the Port Phillip, Glen Eira, Bayside area, that East St Kilda area, so we've spoken about that a little bit, but it's broader than just that suburb. Anyone experiencing symptoms in Port Phillip, Glen Eira or Bayside, we need you to come forward and get tested, and we need you to come forward today. That's over and above anyone who, of course, has gone to the website, looked and seen that they were at a Tier 1 or a Tier 2 exposure site. Of course, you need to go and get tested as well. But anyone in Bayside, Glen Eira or the Port Phillip local government areas who are experiencing symptoms, please come forward and get tested, and please don't delay in doing so. You will be playing a really big and important part in our pandemic response and in our collective fight against this thing. Just specifically, there are testing sites. The following testing sites should be and can be accessed by those local communities. At Albert Park Lake, open from Monday to Sunday, 8 a.m. to 6 p.m. Prahran Town Hall, open Monday to Sunday, 9 a.m. to 4 p.m. The Alfred, Monday to Sunday, 8 a.m. to 4 p.m. And the Brighton Golf Course, Sunday to Wednesday, 8 a.m. to 8 p.m. Thursday to Saturday, 8 a.m. to 5 p.m. So there are lots of testing sites. We'll get you through as fast as possible. If you're a casual worker or someone who doesn't have savings to fall back on and you're going to miss a shift, you're going to be away from work while you isolate waiting for your results, 98, 99% of which are provided the following day, then there is a $450 payment which we will make to you promptly so that you are not financially worse off for having done the right thing by your family and every family by getting tested and isolating until hopefully you get the all clear. Nothing is more important than people who've registered any symptoms at all coming forward and getting tested. And of course, if you've been anywhere near those exposure sites as listed, and they're constantly updated, coming forward and getting tested as well is critically important. They were my main messages, other than to thank everybody across the community who's doing the right things, who knows and understands that, you know, this is a challenging time and none of the decisions that were made yesterday were easy. We know and we acknowledge that there are many elements of these rules, and this whole journey is really tough for a lot of people, in fact for all of us. But the best thing we can do is try and end this quickly, try and get to the other side of this quickly, not have it drag on any longer than it needs to. That's what the advice is designed to achieve, that's what these rules are designed to achieve, but all of us need to play our part in that. Just before I ask Kate to speak, Brett, and then Kate to speak to the specific cases, I just wanted to call out some pretty appalling commentary. Anti-Semitism is unacceptable and evil, and we have a zero tolerance approach to that in our state. The event that we spoke about at some length yesterday was not a function of being Jewish. It was a stupid function. It was an illegal function. Those people are being dealt with. Them breaking the rules was not a reflection on the Jewish community more broadly. It was not an act of faith or culture. It was not something that anyone should use to reflect upon a broader group of people in our Victorian community. We have a proud Jewish community, a significant Jewish community, and it is simply unacceptable and evil for anyone to be trading in some of the anti-Semitic behaviour and comments that we've seen recently. Those people are being dealt with by Victoria Police. There's that anyone needs to be harassing anybody, and there is never, ever a place in Victoria for anti-Semitic behaviour or language. It's simply evil. We called out some bad behaviour yesterday. We didn't call out a community because that would be simply unfair and wrong. And that's clearly evidenced by the fact that so many Jewish community leaders are stepping up and have condemned what occurred and have done so in the clearest terms. I've spoken with many of them in the last 36 hours and I've thanked them for their leadership. So please, let's all of us acknowledge and be really clear about the fact that anti-Semitism is just pure evil, and we're not having that here. We're just not. And if you want to trade in that sort of stuff, well, then there'll be consequences for you too, because that's just not on. Now, I'll ask Brett to speak to the epi picture, and then Kate can take you all through each of the cases, and then Shane can just speak a little bit about what his members, fantastic members of Victoria Police, are doing out there today, and then we're happy to take any questions. I should just say, of course, I'm always happy to stay here for as long as you want me to, although I'm not necessarily challenging you to keep us here for 2 hours like yesterday. But the rest of the team, they've all got important things they've got to get to at about 12:30. So they will leave. Hopefully we're wrapped up by then anyway. Over to you, Chief Health Officer.
Thanks, Premier. Can I also start just reflecting on how horrified I was to see anti-Semitic hate directed at community overnight. It's profoundly wrong. I also want to flag that it is incredibly destructive to the public health response. Hate directed at any community, geographically, by age cohort, by country of origin, ethnic background, language, whatever. It is destructive to the public health response. We've seen it with Islamophobia, and the reality is communities are focused on protecting themselves, their families and those around them, and we should recognise that, and there are many Victorians who are working so hard to do the right thing, and I just want to reinforce that it is incredibly destructive to vilify individuals in terms of getting to where we need to be. So I signed directions into law last night. I do want to thank everyone who's now got the difficult task ahead of abiding by all of these directions. That means observing the curfew from tonight, and tomorrow if you're an authorised worker to be travelling with your permit. It wasn't easy to make these decisions, as I said yesterday, but it was essential. We have to get ahead of this. We have to get on top of it to bring the case numbers down that remain high. A reminder of new restrictions which came into place last night. So from 9 p.m, there are really very few reasons to leave your home in Metro Melbourne. Authorised work, health and medical reasons, or in emergency circumstances. And when you come to work tomorrow, if you're an authorised worker, you'll need a permit. That's online now, so you can access that at the coronavirus website, and there's all the information there about what you need to do in order to generate that permit. We've made further changes to make it clear that exercise isn't an opportunity to socialise in large groups, and that taking your mask off isn't an opportunity for social drinking. Playgrounds are closed. Again, a difficult decision. It affects my family. It affects thousands and thousands of families across Melbourne. But as I said yesterday, the reality is there's a risk of transmission in those settings. 50 of our current cases, active cases in Victoria, are under the age of 10. We've seen child-to-child transmission throughout this outbreak in schools, in other circumstances. It happens very quickly in households between children. And we are investigating a potential transmission in a playground. It's not definitive and maybe we'll not be able to make it definitive, but it looks like there's been transmission in a playground. We've also seen transmission between students who were not in classes together, who did not have any other face-to-face interaction other than sharing a walk home. Didn't play together, don't live together, didn't have classes together. Shared an outdoor walk home and transmitted between them. That is more definitive. So the risk is there. We want to minimise every single opportunity in order to get ahead of this. On wastewater, we are continuing to see wastewater detections across Victoria. They're not definitive proof that there are cases there, but it is a potential early signal, and it was a signal that we saw at 480 Lygon Street that we were able to act on early. And so it was really important to be able to prompt people to test by virtue of that. So we want the same message for these suburbs, the Sunshine West industrial area in particular, and we're reaching into those industries in order to facilitate testing. So please step up to get tested if you're working within that area. The Burundara area continues to ping. Again, no cases identified there, but please bear in mind, if you're symptomatic, we want you to step forward for testing. And the Truganina Williams Landing area are all showing repeat positive and unexpected detections. There's also been a repeat wastewater detection in Shepparton. Again, not definitive of the case being there, but in particular I want the people of Shep to consider, if they're symptomatic, to come forward for testing. If you live or work in these areas, you don't have to reside there. If you're moving into those areas, especially as an essential worker, please get tested. As the Premier said, Glenara and City of Port Phillip are also areas of concern. Kate will talk to this in more detail, but we're seeing mystery cases here. So this is a place to get tested if you're at all symptomatic, if you've been to any of those exposure sites. And there are dozens and dozens of exposure sites now in those areas, so please go to the website to understand whether you might have been to one of them. We want people to come forward for testing, so again, if you live, work or are otherwise moving through those areas, please pay attention to this message. And we want more than 30,000 tests a day. We're just there. We can do a lot more. There's no reason not to go to a testing area. There is a lot of opportunities for testing sites across Metro Melbourne, and there are more that have been stood up in those local government areas in particular. So Albert Park Lake, Paran Town Hall, the Alfred, Brighton Golf Course and others. Some further away may have greater capacity. You can go more than 5 kilometres for testing purposes, so don't feel constrained by that. And visit the coronavirus website to see what the waiting times are, to see what's maybe newly opened and what the operating hours are, and come forward for testing. Thank you. I'll pass to Kate.
Thank you, Brett. Good morning. Of the 24 local cases, I'll just run you through them. We have 21 linked and 3 currently unlinked. 3 cases are linked to Altaqua College, all household contacts, and all were in isolation. 9 cases linked to Glenroy West Primary School, 1 student and 8 household contacts, and again, all were in isolation. We have 4 cases linked to the St Kilda East community outbreak. 3 are social contacts from a private gathering, and 1 case is a contact, or a work-related contact providing care. 2 cases are linked to the housing tower at 480 Lygon Street in Carlton. 1 is a resident of that building and 1 person was providing care to that resident. 3 cases are linked to the Newport community outbreak, 2 being household contacts of previously confirmed cases. Those 2 contacts were all in isolation, and 1 is a separate social contact. 3 cases are unlinked, and this is where I'll spend a bit of time today. 1 case is a St Kilda resident without clear links to other cases, and 2 further cases are known to each other, but again their source of acquisition is unknown. 1 is a City of Melbourne resident and 1 is a St Kilda resident. There are over 14,400 primary close contacts across Victoria now. We cleared 700 yesterday, and we're facing into clearances of approximately 8,000 over the next couple of days. The unlinked cases we've got are concerning, and they're starting to centre around a certain geographic area of Melbourne. We now have 5 unlinked cases related to the St Kilda area. 1 lives in Dandenong and works in St Kilda. 1 lives in Middle Park and works in St Kilda. Others both live and work in St Kilda. The City of Glen Eira and City of Port Phillip, please come out for testing. We're not seeing testing rates high enough, and we are concerned that there are cases here that we do not yet know about. These cases got the virus from somewhere. The virus is circulating in those geographic areas of Melbourne. If you look at the exposure site map on our website, you can see 50-odd exposure sites running from South Melbourne down the bay, down to Brighton. These cases aren't linked by age, they're not linked by faith. They aren't all in the same book club. They're not all on the same footy club. The only thing they share is geographic proximity. They might live or work in the city of Glen Eira or the city of Port Phillip. They have different types of jobs. Some are employed, some are in office jobs, some are in, blue-collar employment. As I say, there is nothing linking these cases other than geography, which is why we do ask that the testing rates increase in that area. As Brett mentioned, you can go further than 5 kilometres to seek a test. If you go to your closest site, there may be active diversions in place so we can manage wait times at those testing sites. Please listen to those diversions. If you think it's going to be quicker to get in the car and go to the showgrounds, please do it. You're free to do so. We just ask that you just go get your test and then go back home again. Thank you, and I'll pass to the Chief Commissioner.
Good morning. Just a quick update in terms of the enforcement approach and what's occurred from a Victoria Police perspective. We still have, obviously, along the New South Wales border, a significant number of police that are involved in enforcement operations along there and conducting a range of checks. We still have the Metro Rural Divide, the Operation Sentinel 5.1, where we have a couple of hundred police who are randomly intercepting vehicles using automatic number plate recognition, conducting a whole range of enforcement activities. We have, obviously, Sentinel, which is our patrols that are just randomised across Melbourne. So, apart from being in hotel quarantine, there's a range of resources that are being deployed to make sure people are complying with the Chief Health Officer guidelines. Now, obviously, that we have these increased restrictions, I spoke yesterday about the relaunch of Operation Shielding, which will involve a couple of hundred police and PSOs, ramping up till we get that number near the end of the week. But what we'll see today is this afternoon we'll see the first of those PSOs coming off the transit network, where we'll be deploying them into those areas that I said we'd be policing, public spaces, in and around shopping areas, all of those places you would expect us to be making sure that we do have compliance. As stated, we will be issuing infringements where it is appropriate, where it's deliberate, obvious and blatant in terms of the breaches. So I'm urging the public, do the right thing, work with us. We don't want to be issuing those infringements, but we'll have no hesitation in doing so if that is required. In regards to what we've seen overnight, our reporting applications don't give us a daily what happened overnight. That doesn't come in till tomorrow. There's a bit of a delay. But up to last night around 11 p.m, we'd given out around 20 or 30 infringements and a number of warnings as well. Overnight, in terms of curfew, which obviously everyone would be interested in, the reporting that I've been briefed on this morning, it was a reasonably quiet night, if you like. There were a couple of people who were apprehended for criminal offences late in the morning out at Noble Park, who will be looked at in terms of curfew breaches as well in relation to their criminal offending. Other than that, we attended, I think, 2 private gatherings that were being held with, I think, 6 and 8 were the numbers at those places. Those people will be receiving infringements in the Melbourne area. But by and large, it appeared to be a quieter night, if you like, in terms of our enforcement responsibilities. But be in no doubt, from here on in, from the rest of the week, we'll be increasing those enforcement activities in the areas I've said. We don't want to be giving out any infringements, but the reality is we're very prepared to do so. So please work with us, do the right thing, and we'll continue to make sure that we have a very large visible presence. Just in regards to the, the St Kilda engagement party, I'll call it if you like, we've been receiving reports that there've been harassment and, if you like, victimisation of persons involved in that. That has to stop. We're the ones who will deal with that matter. We've said we will deal with that matter. We're working with the people who were involved in those breaches. They're being cooperative with us, and we're working through how we resolve it in terms of the infringements and the interview of those people, given that they're now in isolation. So that's a work in progress, and as I said, they are being cooperative with us. It's not for the public to harass them. It's not for the public to harass anybody. Leave it to the Victoria Police. We'll do our job. If you think someone's conducting a breach of the CHO guidelines, simply ring our police assistance line and report the matter, and we'll investigate it. Thank you. I'll cross to the Premier to open proceedings, and then we'll answer questions, I think, as...
That's fine. No worries. So we're all here, and we're all happy to answer any and all questions you have.
Premier, if these
Yes.
testing numbers don't improve, will you consider asymptomatic testing in those 3 local government areas you've mentioned?
We wouldn't rule out anything, but I wouldn't want people to think that, oh, well, I can put off having a test today because they're going to go and test everybody door to door next week. What I'm asking for is what's absolutely needed, and that's people who've been to exposure sites to come forward and get tested, and anybody across the whole state who's got symptoms, however mild, please get tested and please do it fast. Don't delay an afternoon, don't delay 2-3 days, because you may have it and you may be spreading it. The best thing to do is to get tested and get tested quickly, particularly in that Bayside, Glen Ira, that sort of inner south area, and the testing clinics that I just listed. Those sites are open, and indeed there are many more beyond that.
What sort of numbers would you like to see, like 50,000 tests every day?
I think we've probably always been a bit loath to put a number on it. This is by and large the testing of people who've been to exposure sites and therefore are at increased risk, or people who have symptoms however mild. So, you know, this will be determined by how proactive people are. It won't matter what the number is. I'll always want more people to get tested if we believe that there are people out there with symptoms who aren't getting tested. And it's not a criticism, it's just a fact. I don't think every single person gets tested quite as fast as they should. And there are a bunch of people out there who should get a test and probably know they should get a test, and they sometimes don't. I just appeal to them. Vaccination, that's our long-term way out of this. Testing as soon as you register symptoms and isolating until you get hopefully the all clear. That's our way out of this in the short term. That's why people have to get tested as soon as they register any symptoms, particularly in that inner south area, those local government areas and suburbs that we've mentioned today.
This might be one for Kate. Are you aware of more cases linked to that illegal party that aren't included in today's numbers?
It's definitely one for Kate.
I don't have any new announcements to make on new cases from today, but given it is day 14, as I mentioned, we're getting through 8,000 in the next couple of days. I would really expect to see further household contacts and family positives from those original cases in the original clusters a couple of weeks ago.
But specific to that illegal party in St Kilda East?
Well, as I mentioned, in today's numbers of the 24 cases, we have 3 related to that event. I don't have any other further cases to announce related to that event today.
Or any other event? Any other cluster? Any further cases?
I'm sorry?
Any further cases, I mean, irrespective of the engagement party, are there any further cases to announce on top of the 24?
Not on top of the 24, no. The cases from midnight to midnight yesterday were 24 community and 1 in hotel quarantine.
Just to clarify, they were all 3 at the engagement party. You believe that the transmission for all 3 happened at that party?
That's my current understanding. I'd also like to bring the attention to an additional case that was not at that party, as well as our unlinked cases. I'd really like to take the focus off any one gathering. Where we know transmission has occurred at one gathering, our contact tracers can get on top of it. That's why we really need honesty from people who are positive cases, and I thank everyone who provides that honesty and cooperation to our contact tracers. I'd like to reiterate that any information given to our contact tracers is confidential and only used for public health purposes, not for any other purpose. It is not given to any other agency. The cases that provide me and Brett and the Department of Health team with most concern are those that have an unlinked source of acquisition.
We'll get to those in a second, but just 6 cases so far linked to that party. How many tests have come back of those 69 odd people?
I believe we're only waiting for 2 more results.
And 6 positive so far?
That's correct.
And so one of those is not a guest, so 5 guests, is that right? Sorry.
Well, one was the original attendee that we already knew about from late last week, and he obviously attended the party, and there've been an additional 5 on top of that.
In terms of our close contacts, are we using a three-ring approach at this stage?
Yes, we absolutely.
Do
So
we
we
need
go
to-
to primary close contacts, so someone who's been at an event, as well as their secondary close contacts.
Do we almost need to look at extending that further down the chain, given how fast Delta is moving?
Look, we're always willing to look at it, but we have to focus on our highest priorities. Given 14,000 primary close contacts, in our last outbreak with respect to the RL apartments, we got up to 26,000. We need to focus on our highest risk cases and our highest risk of transmission. Going further down the line, we'll take the teams away from the highest priorities.
There's a Newport tyre business that's listed as an exposure site. It was just listed in the past 24 hours between August 2nd and August 9. Is that linked to one of our new cases? And given that our previously known first Newport case emerged on August 4, are you looking at the Altaqua teacher possibly having got the virus from this new case?
We're absolutely always looking to link that original Altaqua teacher and her family back through, through our lines of investigation. Every new piece of information we get can help us link that together. I don't know whether we'll ever find the source for that original case. That Tyres Plus in Newport is linked to a social contact of the Newport community outbreak and the Newport Football Club.
Why are we now on what is today's date, the 17th, I think? Why are we now only finding out about someone who was infectious between the 2nd and the 9th of August?
I don't recall exactly this new case, who they linked back to, but obviously as people forget things, and that's okay, further information comes through with contact tracing, further information comes through with every positive we get, and if there's been a connection out there and they provide that information to our contact tracers, we may find older exposure sites that we need to list on our
Just
website.
to clarify though, was this person's come forward for testing in the last couple of days, and you believe they were infectious from potentially going back to the 2nd of August, is that correct?
That's why we would have dated it back to the 2nd of August, exactly right, based on their infectious period.
Was this person asymptomatic?
Which case was that exposure site linked to?
A case from the Newport community outbreak.
Sorry, were they symptomatic that entire time, or were they asymptomatic and you just believe they may have been infectious that entire time?
I'm afraid I don't recall that detail of that particular case, but we can get that to you.
Are you worried that testing rates around the Security area may be lower given the reaction that's happened to the party, the antisemitic comments that have been made? You just mentioned a comment about, confidentiality in the interview process. Are you worried that people are now fearful of coming forward?
I think that's a real possibility. I think if people are on the receiving end of victimisation or cyberbullying or, certain acts at their private residences and they're not able to feel safe in the process, that's absolutely a possibility that they may be less willing to engage in the process. But I think the Premier and Brett and the Chief Commissioner have all done, a really good job of calling out that behaviour is not acceptable. And so we do ask that people come forward and get tested, no matter which community you're in. It doesn't need to be a faith or school or any other connection. This is a geographic concern we have in those areas.
Could you remind us how many close contacts are linked to that infection party?
How many close contacts in total?
Yeah.
I don't currently have that number to hand. No, I'm sorry.
The Altaqua.
Sorry, just with the unlinked cases, can you just confirm for us, are we standing now at 14 in total? Sorry, 17?
No, it's not as many as 17. I'll have to get that number for you.
And there's been
Sorry,
there's been a... Sorry, there's been... You can
if we assume it's around
we'll
the
finish
20
over
mark,
here. Yes,
sorry,
that's
just to
all right.
follow up to this. If we assume it's around the 20 mark, how realistic do you think it is for the next couple of weeks for this number to come down to 0? Given that we've had, as the Chief Commissioner said, there were 2 private gatherings yesterday. There might be more that we don't know of yet. What is the outlook for the next couple of weeks?
Sure. I'll repeat what I've said on previous occasions. Where we know about something, we get on top of it. We've been able to really get around Altaqua. In the past, we've got around Ms. Frankie's. We're getting around Glenroy West Primary School, and those cases we're seeing now are household contacts. We know the attack rate through households is unfortunately really high with Delta. So that's, again, the call for testing. Whether you've got symptoms, whether you're concerned, immediately as you have symptoms, please come forward, because once we know about it, we will use all the tools in our toolkit to test, trace and isolate and get on top of it. That's how we reduce the number of mystery cases.
Sorry, there was a case that was identified as a parent at a Carrum Downs childcare centre that attended on the 11th and 13th of August. Do you know where that case fits into today's numbers?
Yes, that case is linked to the St Kilda East community outbreak.
As in they attended that engagement party, or they're a social contact?
They're a separate contact.
How concerning is it just on that we've got a positive case that's attended a childcare centre? Obviously, this is another one of those vulnerable settings.
Look, we don't wish to have any confirmed cases, and especially, of course, there's concern where they are in high-risk settings. It might be disability settings or other settings where, you know, we've seen it before in high-risk workplaces. We will obviously go through our usual public health actions. We'll identify the primary close contacts from that childcare centre. We'll test, we'll trace, we'll ensure people isolate to get on top of it.
Have any of these mystery cases in the St Kilda area been to the same supermarket or same park?
I wish we'd found that. No, we haven't found one area of those mystery cases all being in one place, in which case we would have linked together as a cluster. We are worried, of course, that this is a cluster that is unlinked and a little bit amorphous, and we don't want it to grow. We don't want a cluster of epic proportions in St Kilda. We ask people to come forward to test.
Is it a hypothesis that they are connected to the engagement party?
Not at all a hypothesis. As I mentioned, these are not the same. They're not in the same social circles, they're not in the same friendship groups, they're not at the same school. The only thing identifying them together is geography.
Do you believe that there are just...
Sorry, just at the Coles Balaclava Tier 1 exposure site, can you explain why the advice around that site has changed? I think it was Tier 2 initially.
Yeah, that's right. Coles Balaclava was originally called out as a Tier 2 site. Upon further review, including working with the Coles management, reviewing CCTV, all the usual actions we usually take, we've upgraded it to a Tier 1 because we are concerned that the risk of transmission during that, I think it's 3 or 4 hour period, is higher than we originally believed.
So was that person working there, or were they there for 4 hours?
I know the person attended.
Were they there for a few hours in that period? Or how many
I
hours?
don't have the specifics of how long they were at Coles, but certainly we've put that 4 hour period around it for the information that they've given throughout contact tracing and through our reviews and so forth. It's possible they went in 1 or 2 times, but I'm hypothesising. I'm afraid I don't have the specifics around their visit to that store.
The LD in Roxburgh Park says it was advised that it was a Tier 1 site 24 hours before it went on the website. Do you know why that's happened?
I can look into it. We've got 540 exposure sites at the moment. There's a lot of work going on by the teams. There may be occasional delays, but as always, we thank communities for getting the word out there for us. I know, for instance, the childcare centre in Carrum Downs was able to alert their patrons and their kids and families before we've been able to list it. And again, that's a great result. We want the information out there so people can isolate as soon as we can, and our teams will publish it as soon as we possibly can.
Kate, another 3 cases from Altaqua today and 10 yesterday. Are they all day 13 tests?
Most of them are coming up to that. Others sometimes will test earlier because they become symptomatic.
And how long until, I don't know if you know the primary close contacts of Altaqua, but how long away are we from that just being completely off the board?
Should be 48 hours. Of course, there will be some because of, further positives in households where that sort of 14-day period gets extended a little bit because they're still living at home, and as people turn and the 14-day kicks off again. But yeah, 48 hours we should be clearing the bulk of Altaqua.
I just want to ask a similar question to one that was asked of Kate, Premier. We've got now, I think it's 12 either clusters or index cases that have an unknown acquisition. Yes. That's 12 other cases we don't know about, probably more.
Yep.
At what point do we start preparing and being honest with the public about how likely this is going to be, how long it's likely to take to drive this outbreak right to the ground to get out of it?
Well, first of all, I would hope you're not suggesting that people haven't been clear and direct and honest. I wouldn't want that suggestion made because that would be simply wrong. So I'll take it that that's not what you were alleging. We've been very clear that this is a serious set of circumstances. I think I used the term tipping point yesterday. You don't get much clearer than that. If we want this to be over, then we have to get tested when we have symptoms. We have to get tested if we've been anywhere near an exposure site. We have to participate fully in that contact tracing process, and that's what people are doing, which is a fantastic thing. And we also need to make sure that we follow the rules. And we're not any of us making decisions that might contribute to the spread of this virus. That's how we first of all have no new mystery cases, and then beyond that, we let the coronavirus detectives do their work and run as many of those mysteries to ground, solve those puzzles, and then we can move forward from there. But you know, it may be that some of those cases we never know where they picked it up from, but we're not about getting to a zero risk outcome here. We'll never get to that, even when 80+% of the community have been through the Commonwealth's vaccine program. We won't be zero risk, and we will never have a situation where we've literally tested every single Victorian on one given day and then we can say we are coronavirus free. It'll be difficult decisions to be made in the coming weeks about opening up. Let's make sure we can have those difficult discussions. Let's make sure that we can have those options as real options, because we've all played our part, we've all done the right thing, and most importantly, we've all gone and got tested as soon as we registered any symptoms whatsoever.
If we aren't able to solve as many of those mysteries as we'd like, and the professor usually likes to solve all of them before we get out, which is very reasonable.
We would like to, yes.
If we aren't
but we're realists though.
Yeah, if we aren't able to, and it may prove difficult given Delta's much more difficult than last year's variant. Does it get to have you started thinking about when the language and the strategy shifts to vaccines being the way out rather than zero unknown cases? Is that part of your thinking, really ramping up vaccines like New South Wales is doing in case we need to be in this for another month, 2 months?
Well, I think it's important to acknowledge that no matter what any other state's doing or choosing to prioritise in their daily briefings, the national strategy remains the national strategy, and that is to actively suppress this virus as best as we possibly can. Now, sometimes that'll mean you're down to zero cases, sometimes you just won't be able to achieve that. We're not going to be indefinitely locked down. We've got to do our very, very best to avoid what Sydney's going through at the moment, and that, you know, we send our best wishes to all the team up there, and we wish them success. Their success will be our success, just like their problem has become our problem. Delta does move very fast, but no one's walking away from the National Cabinet agreed position, and frankly, we don't have enough vaccine and it's dangerous to pretend that we can just vaccinate our way out of this in the next few weeks. We don't have enough vaccine to do that. If we did, then we would, wouldn't we? Of course. That's not on the table. I would say, though, there are 300,000 appointments that I've announced over the last few days. Not all of them have been taken up, and I'd encourage anybody who wants to go online and book one of those appointments. As has been noted so many times, the best vaccine is the one you can get today. So vaccines are very important, and I'm encouraging people to get vaccinated, but we simply don't have the supplies of the vaccine to be able to speak in those terms. Plus, I would just say we've got an agreed plan that says when we get to 70%, this is based on Doherty modelling, like a lot of work. When we get to 70%, things become possible. When we get to 80%, then you're not in lockdowns anymore. You've got a degree of protection and a degree of certainty, and the future looks very, very different. That's the agreed plan, and no one ought to be walking away from that, and I'm not sure that anybody is.
Is it foreseeable that to follow that agreed plan, to only come out at 70, that we actually need to stay in pretty much indefinite lockdown because it's far too difficult to drive this down to zero or close to it?
No, I think that's what we're trying to avoid. So we're trying to avoid
being in... What gives you confidence we will be able to avoid it?
Well, we've defeated Delta outbreaks before. We've not seen this spiral into hundreds and hundreds and hundreds of cases every single day. We're not at that point. We're determined not to get to that point. But I think, again, we are, I think, in absolute agreement. We're kind of arguing the same point from slightly different angles. But what I don't want is this limbo position where we don't have the hospitalisations that New South Wales have. We don't have the tragic deaths that they're having to deal with at the moment. But we have too many cases to open up. That's why we've got to drive this down as low as we can. And maybe zero is possible, maybe every case can be linked, or maybe not. They're the really difficult decisions that the Chief Health Officer and his team make and that Cabinet makes.
But Premier, we've had
no mystery cases before we leave this lockdown.
Well, we will do our very best.
Do we have to? Is that the goal here? Do we have to hit zero mysteries before we leave this lockdown?
No, we don't. But it would always be preferable to have every case linked. But it may well be that despite our best efforts, despite sewerage testing, despite contact tracing, and with the passage of time, a case that is quite an historic case but is not a mystery that's been solved, you know, you would look at that and you'd say, okay, well, can we open up now? They're really difficult decisions to make. But it's not as simple and it's not as binary as that. And whilst I don't want to necessarily take us into a big, long discussion about the fact that there are different types of mystery cases, there are mystery cases that have not necessarily circulated very much. And then there are other mystery cases that have been part of a whole series of events and gatherings and been very active during their infectious period, all of those sorts of things.
Based on
there are different sorts of mysteries in this.
Based on those mystery cases that you say are circulating and have had a lot of exposure, what's the health advice for how long that will take to drive down?
No, there's no health advice about, there's no crystal ball here. It'll be driven down as quickly as we can do it. And we're hoping, with the cooperation of every single Victorian and people, for instance, listening to our request today to go and get tested in that Port Phillip, Glen Ira, Bayside area, that come Thursday fortnight, so we've had a 2-week extension from this coming Thursday. We're all going to be working as hard as we can, all of us, to try and be able to ease rules then. It is in our hands to a certain extent, though. If we all play our part, then the advice is that, you know, we can be in a very different position in a couple of weeks' time. We're all just, there are no certainties. There are no guarantees. I can't predict where we'll be with that absolute certainty tomorrow, let alone in 2 weeks' time. But what I can be certain of is that if we don't follow the rules, if we don't get tested, if we kind of pretend it's over because we desperately want it to be, then we will be locked down until 80+% of us have been through the vaccination program. That's what Sydney's facing. We have a chance to do something different. That's what I'm working towards, but we can't do it on our own. We need the Victorian community to work with us. And thank you to every one of the millions of Victorians who are.
Have any of the mysteries been linked genomically yet?
There's no update on genomics. We keep doing that genomics, and sometimes it'll give you vital pieces of that puzzle, and sometimes it doesn't. What we know is it's from Sydney. What we know is it's Delta. There are various linkages, but it's not conclusive to the point where we can, be certain. If and when that occurs, we'll be sharing that with you, because that'll be a really important day.
We've had 2 weeks of pretty harsh restrictions.
Of course, can.
Just before we have to leave, Chief Commissioner, how many Melburnians have police caught outside Metro Melbourne, and have we actually issued any fines to any Melburnians in regional Victoria?
I don't have the actual figure as to how many people have gone into rural Victoria when they shouldn't have, but on a regular basis we're issuing small numbers of those, 2, 3 sort of per day, those sort of numbers. So we're not talking big numbers at all, but we are identifying those people through assistance from the people in regional Victoria, through the patrols that we have out there that's around Melbourne that has that specific role. So I'm very confident that we are detecting the majority of those, but the exact numbers I don't have with me.
And are you encouraging businesses that do turn away Melburnians to dob people in?
Oh, it's an interesting terminology. It sounds un-Australian, but to say dob people in, what we're saying is don't serve them, and if people become aware of any breaches of the Chief Health Officer guidelines, 131444, ring that number and we'll deal with it. That's what we always urge. That's the expectation, and nobody wants people coming from Melbourne against those guidelines, because we've got that divide in for a reason, to stop the spread of the virus.
We have heard a restaurant owner in Daylesford who says they're turning away between 10 to 15 Melburnians pretty much every day. Is that your understanding of things?
Oh, look, I've heard reports of different numbers of people being turned away, but again, I would simply urge those people to notify through the police assistance line. Not only that, we have local police who are tasked and who are doing foot patrols. We've got specialist units out there in the country under our Sentinel banner. So everyone is doing what they can. Of course we can't be everywhere, and we will miss some people, of course we will. But that's why, as has been said at these press conferences again and again, it's reliant on the community to do the right thing as well. We'll do our bit through an enforcement perspective, but it has to be led by the community as well.
Do we know how many of the people in areas like Dalesford who are being picked up might be Melbourne residents who've chosen to spend the period of lockdown at a second residence, as opposed to people who are risking transmitting the virus by travelling directly from Melbourne?
No, we don't have those details as to whether people who might be getting picked up for detections up there have legitimately relocated in accordance with guidelines. No, we don't have those.
And just, have you had any backlash from police members who are effectively now being asked to fine parents for allowing their children to play on playgrounds? I mean, obviously we're in unprecedented times, but that's something that would have been unthinkable, you know, a year or two ago.
I haven't had any backlash personally in regards to what I'm asking of my officers. What I'm asking them to do is to go out into the public, talk with people, encourage them to move on. As I said yesterday, we're at a stage where we need to be issuing infringements where people are deliberately, obviously and blatantly disregarding the Chief Health Officer guidelines. There is still a very small window period of discretion, and you can never take that away from a constable because each circumstance will be different. But it's incumbent on people to do the right thing. The guidelines are in place for a reason. We're going to do what we can to enforce them. Do we want to be in this situation? No, but it's where we are, and we will do what we have to do.
Have any parents been fined yet because of playgrounds, the rule?
I'm not aware of any parents having been fined in respect to any playgrounds. No.
What about warnings?
Oh, we give out thousands and thousands of warnings. Again, I'm not aware of any specific examples, and I wouldn't expect that would get reported up to me. It would happen on a regular basis. Right throughout lockdowns, we have members who've given out numerous warnings, who have recognised circumstances where there might have been inadvertent breaches, people don't understand they're breaching. So we have applied discretion, we have applied those warnings. Police are very good at working and using their common sense when they're dealing with issues.
Can we be clear for parents what they can do? Obviously, they want to get their kids outside after a day of remote learning at home. Obviously, playgrounds are closed, but can they take them to the Oval for a run around? Or what can they actually do?
It's not for me to sit here and step through the interpretation of the CHO guidelines. I would simply urge everyone to make sure they're familiar with what they are, and when they go out, do the right thing and adhere to them. You go out for exercise, and that's pretty much it. You go to do the necessary shopping, etc. There's those reasons for leaving home. People should look at those, and they should try and limit their movement. It's as simple as that.
Given that the they've lost thousands of dollars, do you regret naming them at all?
When you say do I regret naming the Peacock Inn, I regret the ambiguity associated with the discussion yesterday. I think from recollection I said something like, and it's been reported, as has been reported by you, the media, in respect to the Peacock Inn, and then I went on to speak about how a musician or someone was playing music nearby and people were sitting outside that location. It was done as a reference point. There was some ambiguity in my language that is reflected adversely on the Peacock Inn. So, yeah, I'm sorry that there was that misinterpretation, because my understanding is that venue wasn't serving any of the alcohol or any of the food involved. It was used as a reference point. Could I or should I have been clear with my language? Yes, and so I do regret that, because businesses who are doing the right thing, we don't want them to suffer any more detriment than currently is being caused because of what they're experiencing.
Can we please get the Chief Health Officer for a question or two this time?
Yeah.
Professor, could you share some of your contingency planning in terms of, if lockdown fatigue has been the main reason for people flouting the rules lately, how concerned are you that the lockdown extension might not be a sufficient deterrent? And what would you think beyond that to try if that doesn't work?
Look, crystal ball gazing is probably the least productive use of our time here every day, honestly. We are confident that the additional measures will have an impact on the movement, on the interaction of people. So I do have confidence that it's going to be a driver that will help reduce transmission. Fatigue is real. No one argues with the point that we are fed up to the back teeth of being stuck in our homes and not being able to interact with our loved ones and our friends and family. But I think Victorians understand what's at stake here, and I think they are reflecting on how it could go and are not wanting to go to that place. So I think we'll do our utmost in reinforcing those messages, but we all have to wear the awful choices that means that we can't take a different path and expect that it will just not put us at supreme risk. I've got 2 minutes. So
in terms of what's at stake, we've had 8 females under the age of 18 die by suicide, according to the latest coronial data between January and July this year. That's the highest number in 5 years. 51% increase when it comes to teenage self-harm at emergency departments. I mean, how are you preparing, or how do your rules take that into account, given this mental health emergency that we've heard so much about?
These are absolutely tragic circumstances, but I've been asked this question 100 times. It's always the same answer, that the alternative is that this goes on for longer and it's harsher, or we suffer hundreds of deaths, literally hundreds of deaths from coronavirus. And they would be deaths in families that have young people, that have grandparents, parents. There have been millions of people orphaned by coronavirus around the world. Officially, there are 4 million plus deaths. Unofficially, the estimates are over 10 million, and we're maybe halfway through this pandemic for much of the world. If there were an easy path here, we would choose it. The awful consequences of lockdown are apparent to everyone, myself maybe more than most. And if I could choose otherwise, I would choose otherwise. All I can say is that my heart breaks, so many people's hearts break at the prospect of the sadness and the despair that people experience because of the challenges of lockdown.
Patrick McGlory has called this morning for a mental health commander to stand up at these press conferences each day. Is that something we should be doing, to have a mental health professional stand up and talk to Victorians about how
I'd certainly support it. I think we need, we need the guidance, we need the messaging that tells us how best to manage in these most difficult of circumstances.
Just on that earlier point, if these case numbers don't drop by September 2, would you commit to, lifting the curfew and easing these new restrictions to give people some respite?
I'm not going to go to decisions
approach?
that I may or may not make 2 weeks from now.
In terms of the reality, though,
Sorry, I've got to go. Thank you.
Well, let me pick up the point about a different approach. Look, sometimes what happens in this room can be really well connected to what's happening out in the real world, and sometimes it isn't. I think people out across Victoria know that there isn't another way. That if there was another way, we would have chosen that. And it's not just me saying this. There's every epidemiologist that's working for any government in our country. It's every head of every government in our country, including the Prime Minister. This is across the political divide. This is a national cabinet agreed strategy that there's no other option with Delta. It moves so fast. We don't have enough people vaccinated yet. They're just facts, If we could change that, we would. As I've said many, many times, and I think the Victorian community know this, if we could do it differently, if there was another way, if there was something else to try, then of course we would. And we wouldn't be locked down at the moment, and we wouldn't have had to receive advice about curfews and things of that nature.
Speaking of curfews and speaking of epidemiologists,
Yes.
There've been a number of epidemiologists over the past 24 hours who've disputed the efficacy of a curfew specifically. You've talked about suites of measures, but what specific evidence relating just to a curfew are you able to point to that proves that it works?
Well, it's not for me to prove the efficacy of any one measure. What proves the... No, hang on. No, it's not. No, frankly, it's not. It is not. No one has ever maintained that any one measure is the way out of this. So therefore, it is not for me to provide hard data that establishes that. I've never made that claim. We have never made that claim.
But surely
if one thing alone... Hang on, let me finish. Let me finish, please. If one thing alone was all we needed to do, then we would just do that one thing. We have a suite of measures, and we have an experience, a tragic, terrible experience from last year, where we went from more than 700 cases a day to 0. And each of those measures played a part in that. And that's why the Chief Health Officer has provided his advice to reinstitute the curfew. And I hope that what the Chief Commissioner has already reported on, a relatively quiet night in terms of people being out and about during those curfew hours, I hope that continues, because less movement will mean less spread of this virus.
But how many cases in the current outbreaks have been acquired outdoors after 9 p.m?
I don't have the exact...
Have any of them?
Well, let me come back to you with that level of detail. This is not about... Yeah, but let's be really clear. This is about stopping further cases. We can't reverse those positives that are already there. A curfew, as part of a suite of measures, is the advice from the Chief Health Officer. It played a part, I believe a significant part, as a suite of measures last year. And that's why we've accepted the advice of the Chief Health Officer, as difficult as it is to make some of those decisions. But let me just be clear about the shocking impingement on people's human rights. Like, it means you can't go shopping in the middle of the night. It means you can't go and do your exercise in the middle of the night. And for anyone inconvenienced by that, of course I apologise. Some people, shift workers and others, maybe they do their exercise at 2 or 3 in the morning. This is about getting out of this. It's difficult for a short period of time. Hopefully we can drive these case numbers down, and then we won't need a curfew. And we'll be able to get advice that we can lift it. That's what we're aiming towards. That's what we're working towards. But I have never said that one thing alone is a magic wand with this, and therefore I'm not in a position to be able to talk to you and provide you with hard data to support a claim I've never made.
But why now for the curfew?
Because
was it the scenes over the weekend that
well,
led
the Chief
you
Health
to
Officer
putting that
has
measure
looked at movement, looked at behaviour, looked at compliance, looked at the epidemiology of these mystery cases, looked at the fact that we have an opportunity to not be locked down till everyone's had the jab, that this can be weeks rather than months and months and months, and he's made some hard calls.
So, Premier,
and he's provided advice, and the government has accepted that advice. Sorry?
Those scenes over the weekend that we've seen in South Yarra and Richmond, that was people gathering during the day, pub crawls in the sun, making the most of the weather. So what evidence is there that you need to have a curfew preventing late night? Do we have people who are gathering late at night?
Oh, absolutely. You asked me earlier on whether any of them have tested positive as part of these 25 cases. I'll come back to you on that. I don't have a detailed breakdown of the exact movements of every person that's tested positive. But what we're trying to do is to prevent further cases. And what we know is that movement means virus. And if you've got symptoms, you've got to assume that you've got this. That's why we want people to come forward and get tested. Again, no one enjoys having to make any of these decisions. And there was a comment before about, how unprecedented this is, and did we ever think we would be in this position? There's a long list of things that we're all having to live through that we never thought we would have to live through. That's what a 1 in 100 year event is all about, tragically, sadly. But best we get these cases down, best we get out of these settings as fast as possible. And the way to do that is to act quickly and to make these tough calls. And they are tough, absolutely. They are tough on all of us. But they're what is necessary, and bringing this to an end is absolutely our aim.
But Premier, were you happy with the look?
In my briefings from authorised officers and police.
Groups and police.
Yes.
Is there a way kind of to track day on day the impact of kind of the shock and awe measures from yesterday to try and observe if compliance is increasing, if there's less rule-breaking behaviour, less nighttime movement?
Yeah, I think it's more sort of trend than going through individual cases. But I would hope, and this is not just a matter of enforcement, but it's a matter of those choices that people make. And there was a question before about, are people not coming forward to get tested because of some of the reactions to poor behaviour? Well, I don't think that's driving it. I think that there's just a bunch of people who are choosing not to get tested. And we're asking them, no sense of criticism or anything, just please, if you've got symptoms, come forward and get tested, particularly if you're in Bayside, Glen Ira, in that sort of inner south area, please come forward and get tested. That'll make a massive difference. We'll monitor the data, police will monitor the data, and we'll hopefully be able to report some positive trends as these days unfold. We've still got a way to go with this. This is not over. We wish it was, but it isn't. Hopefully we see less of that kind of behaviour we saw last weekend because of these measures. Hopefully we see, less of some of the casual stuff. Oh, well, I'll just sneak over to see a friend, or I'll go and visit my sibling or whatever it might be, a lot of which does occur after dark, a lot of which does occur during those curfew hours. The curfew makes it really clear. You've either got a reason to be out or you don't. You're in breach of the curfew, and police will issue fines. And that does drive down movement.
Premier, are you
and that's tough, but it works. It's worked before and it'll work again, we hope.
What is the medical advice that it works, that a curfew works?
Well, the Chief Medical Officer's just signed it into law. So unless you're submitting that he doesn't do his job, then that's the answer to your question.
Ultimately, that comes at a cost, though.
It's at the end of a piece of paper with his signature on it. They are his orders.
Ultimately, that comes at a cost. I'm not sure if you've seen the images of the empty streets with 50 police in the city last night, or the images we've got today of police waving on parents and kids from playgrounds. Are you happy with the perception almost of a police state to get this job done?
It's not about perceptions. This is about reality. And the reality is if we don't drive these numbers down, we're going to be locked up for much, much longer than I would like us to be. I want to bring this to an end. And I want to get us open, and I want to resume our economic recovery, which is something we can all be very proud of. We've created jobs, and we were growing strongly. You know, I can't rewind. I can't send this back to New South Wales where it came from. We've got to deal with what's here, and we have to acknowledge that Delta is different. Delta is different. But, you know, if we all play our part, this strategy will work. We've all got to play that part, but it's not about perceptions. This is about reality. We either do this hard work and find it in ourselves to get to the other side of this, as hard as it is, or we have our hospitals full.
But those
and not
also
just
have
of
a mental
people,
health
as tragic
cost.
as it is, not just of people who are 90, not that that's ever a good outcome, but, you know, it'll be people who are much, much younger, and it's not the flu. It's not the flu. It's very different to that.
It's not just perceptions, Premier.
You're asking me about what things look like, and what I'm saying to you is the time for that's long gone. What I'm interested in doing is following the advice, being guided by the science, working as hard as I can, and with the Victorian community to drive these numbers down. That's what we are absolutely into. That's what we're going to do. Sorry. Yep.
What's your message to people who are really upset by the fact that we haven't seen any deaths from COVID in Victoria this year yet, but we have seen the deaths of 8 girls that we've learned of under these restrictions?
Yeah, but hang on a minute. Hang on. We've got a coronial report. Every suicide is a terrible tragedy. But let's not be speaking as if we can attribute with absolute certainty what motivated each of those tragic acts. Terrible thing, right? No one's for a moment. No one has any different view. You know, it's terrible to see anybody harm themselves, and particularly anybody take their own life. We know that there is a cost. But the difficult decisions that the Chief Health Officer has to make when he formulates his advice, as he's just, I think, quite powerfully and emotionally indicated to you, all of these things weigh on him. They weigh on all of us. There's no easy way here. And it's not like there's, well, you know, these are choices you're making, and you could go and do something much better and much different. You can do things differently. There's not a better way, though, I'm afraid. And that's the frustrating thing about this. You can either have hospitals full, and believe me, it's not just full of COVID patients. There'll be many people who miss out because the hospitals are full of COVID patients. We've been through this quite a few times.
Premier, can you tell us why your government is refusing to release regular reports compiled by the Victorian Agency for Health Information detailing an explosion in mental health cases?
No, that's simply wrong. Look, let's just pause for a moment.
Is that true? Is that information available?
I'll check for you what information's available, but if I can answer you, I will. I'm happy to follow that up for you. I did see a story today in one of the newspapers. Let's just pause for a moment. Are people seriously putting it to the government and to me that we've been less than forthcoming when it comes to mental health? We've just finished Australia's first and only Royal Commission into the mental health system. What's more, I have committed to implement every one of its findings. And we've provided billions and billions of dollars more than any other government in the history of our nation to build a better system.
But is that information
I don't think anyone,
publicly
frankly,
available?
self-praise isn't worth much, but I think I've got a very strong record of being very direct and very clear that this system's broken and it needs to be fixed, and now we're getting on and doing it. As for spreadsheets and data and that level of detail, I'm more than happy to follow it up for you.
Surely that would...
But I don't know that it's necessarily fair or accurate to say that the government hasn't made mental health a priority and been pretty transparent about it. but we do know we have to do more. We do know we have to do more because we've got more demand for services.
Do you like the idea of a mental health commander? And is there anything you can do in terms of immediate resources to mental health that have an effect now?
Well, a couple of points. There are additional resources that have already been provided. If we have to go further, we will. I've known Pat McGorry for 20 years, and I respect him, and I have a very high regard for him. I wouldn't want, however, anyone to come to the conclusion that there aren't people who are focused on mental health as part of our pandemic response. They absolutely are. We might have to get Pat along to talk about some of these issues, but we talk to him regularly. We talk to many people in the mental health field to make sure that we've got adequate resources now. And when this is over, so much other work will just start. It'll just be the beginning in so many ways. There will be consequences and challenges coming out of this pandemic and during it that are not about a virus. They're broader than that. We're going to have to be there for those students, for those clients and patients, for those families, for those workers, whether they're in Melbourne or the suburbs or the big regional centres or the smallest of country towns. That's a job that'll be there for all of us.
Just in terms of hope for people coming out of lockdown,
yes.
Do you think has consideration been given to stop putting end dates on the lockdowns that then get extended? Does that create false hope and potentially perverse incentives for government as well to keep the timeline met, which maybe makes risk-taking behaviour from government more likely?
I haven't given a lot of thought to the first part of that. I think that if I stood here and said this is an indefinite lockdown, and I'll just, I'll get back to you when I'm going to lift these rules, I reckon you'd all have a view about that. I think the community probably would too. I remember standing here last year when there was quite a bit of willing questioning about the need for a roadmap. We then produced a roadmap. Then we had lots of willing question about whether the roadmap could ever be delivered, and then it was delivered literally to the absolute day. To the absolute day.
There was a 6-week extension in between that.
Well, yeah, and the roadmap was updated, and the modelling was updated. Again, we had a willing exchange. That was all part of last year, and no doubt it'll continue as part of this year too. I don't think, like an indefinite thing, I don't think that'll do anything for confidence, and I don't agree with you that we're kind of forced into making decisions because of timing. We make decisions based on advice, and the advice is provided off the best assessment of what the virus is doing, what the community's doing, and a whole range of other factors, like what's happening in other parts of the country, all of those things.
Premier, why aren't Year 12 students being prioritised for vaccines?
Well, it's about how much vaccine you've got. I've just made a whole lot of announcements about 18-year-olds being able to get Astra. So we are prioritising younger people, and we're seeing many thousands of them come forward. There simply isn't enough vaccine to be able to prioritise everybody who's got a solid case to be at the front of the queue. I've made that point a few times. So it's not you can argue your case really well. If we had more supply, you would be a priority group. There's no sense of criticism in that. We just don't have enough. There are, however, 300,000 appointments or thereabouts, extra appointments that we've put up on the website. Some of those are gone, but there's still plenty that are available, and I would commend to anybody of any age, there's a process for either of the vaccines. Please go online, please make an appointment, please turn up, please get your first shot and then your second.
WA is opening up Pfizer for young people. Why aren't we at this stage?
Well, every state's different, and I'm not here to criticise WA, but we are getting plenty of jabs in plenty of arms, and we'll get to kids when we have the supply required to do that. And maybe we'll go beyond 18. Maybe we've got, for instance, we've got a vulnerable cohort, kids 12 and over. They've been pre-approved, if you like, to be part of the vaccination program. That's a few 100,000. Obviously, there's more than a few 100,000 12-plus-year-olds in our country. Hopefully, we can get to a point where we can vaccinate all of those kids. That's not now, though, because we just don't have the supply. Again, our state clinics have done more than I think any other state. As a state, we haven't done as much as New South Wales, but I know our GPs are keen to do more. I know pharmacy's coming online. My conversations with the Pharmacy Guild, they're really keen that people know and understand that soon there will be hundreds of pharmacies who will be offering this.
But aren't we 2 weeks out from when young people should be eligible for Pfizer? We were always told September, according to the federal government rollout. What's our plan? Is that happening on September 1?
Well, so if I just take you back to your question, you've just referenced the federal government. I'm not from the federal government. We will get as much into people's arms as fast as we possibly can. If you want to talk about the rollout in the federal government's program, then you need to speak to them.
Other states are right now putting in plans for that to happen as per the federal rollout. So
yeah,
where is our plan?
Well, hang on. We'll make further announcements when we're ready to make those further announcements. I wouldn't draw any... Seriously, I've just stood here a couple of days ago and said, we're going to get 1 million jabs in 1 million arms over the next 5 weeks.
Will that include Pfizer for young people in those 5 weeks?
No, I'm not announcing any. If you let me finish, I haven't announced any additional cohorts. And what's more, apart from AstraZeneca being available in our state hubs, all of them, 18 to 39, that's an expansion. It wasn't there previously. If and when we have further announcements to make about vaccines, then we will. But today's not the day for that. I will, however, take the opportunity, because I think it's only fair, to remind everybody that there's, about 300,000 extra appointments up online. Please go and have a look. Best vaccine's the one you can get today, and there are appointments available today. Please go online and please be part of that.
Don't we need to start rolling out bookings for Pfizer if that is happening next month for young people? Don't we need to start lining up bookings if that is happening next month as planned?
I'm not here today to... I think it's pretty clear we've done all the things we need to do. We've demonstrated that. That's why we've got more people through our state clinics than any other state.
New South Wales is offering Pfizer to young people. Queensland, WA. Why is Victoria not there?
Well, we will make further announcements when we're ready to do that. Today's not the day for that. And I don't accept any sense that we're not doing what needs to be done. We're in fact exceeding and doing more than I think the Commonwealth Government thought we were going to do. We're playing our part, or Victorians are playing their part, through their government, through their nurses, through doctors, pharmacists, all sorts of different people. We're playing our part across the board, but most notably in our state clinics. That's why we've done so many jabs. And we just expanded those appointments and the eligibility. And the response has been really, really strong. So I'm very grateful to people for coming forward.
Premier, I understand the plan is to drive down transmission, reopen in a couple of weeks' time. I guess the feeling among people watching at home is, given the situation in New South Wales, given the incursions we've had from that state, is it going to last? Like, we've had, 1 week where we were not even at normal.
Yeah, it's very challenging. It's incredibly challenging. I don't think it's possible for us to have literally nobody, like 0 people, come to and from New South Wales. There are all sorts of different reasons why it is important, some would argue essential, to move back and forth. So there's always some risk. It's back to that point I've made, I don't know, literally thousands of times. We'll never get it to a 0 risk. There'll always be some risk. The problem with Delta is the margin for error is tiny. It's tiny. And one case becomes hundreds of cases really fast. That's the terrible nature of the challenge and the bind we're in. And that's why I can only speak for what we've done. That's why we lock down fast. That's why when we get advice from the Chief Health Officer that we all know will not be well received and will not necessarily be popular, we follow it and we do what has to be done to drive these numbers down and have a chance, I think a really good chance, of having these numbers at a very low level, not 400, 500 cases a day, but something very different. And then we'll have to work as hard as we can to not only get open, but stay open. And part of that will be vaccinating as soon as this supplies really start to ramp up, and that's only a few weeks away in some, if all the timelines are met. In the meantime, there's appointments online. Please go and book one and play your part in protecting yourself, your family, every family, and getting us past these lockdowns.
But as you've said in the past, New South Wales, it's not just a state issue. Every state impacts on the nation.
Yeah, absolutely.
Do you feel like it's gotten to a point there where it's just out of control and it's going to affect us reopening and having life as normal?
Look, I've made a few comments recently and I didn't really say much last year about this because it wasn't appropriate. I was much more focused on other things, and I still am to a certain extent, so I don't want to make a big deal of this. But, there are a few people who, were not necessarily, or some people who were not necessarily as supportive of Victoria as they perhaps could have been last year. Some of them were indeed Victorians. So giving people the benefit of hindsight, wisdom, kind of poking fun at people, that doesn't do anyone any good. We didn't enjoy it last year as Victorians. We just didn't. And I certainly didn't as the leader of our state. I won't do that now. We wish them well. And my regret at the moment is because we've got cases that have come from New South Wales, I can't have Victorian contact tracers helping New South Wales. They're all flat chat doing work for us here. As soon as we can bring this back under control, drive these numbers down, then we will be able to help our friends in Sydney and indeed right across New South Wales, as we have done in the past.
Just back on vaccination, do you know
Yes.
if there are any aged care workers who are still waiting to become fully vaccinated? I appreciate the majority of it is a Commonwealth
Do you
sector
mean
in Victoria.
Public or private?
Combined. Do you have any? I appreciate that the
Yes,
private
it's hard to combine it though. There's a public system, which is about 5,000 beds. I think we're at 80+%. I'll try and get the numbers for you, but we're very close to essentially having fully vaccinated all of our workers in our aged care settings. Private aged care is nowhere near that number. Nowhere near that number. There's a big job of work to be done there. And
are we still looking to make it mandatory for them and maybe disability workers in September?
I need to be careful here. I don't make those public health orders, and I don't want to be the subject of some legal challenge about that. That is a matter for the Chief Health Officer, but I understand that he will soon make a public health order. To be honest though, the easy way out is to say, it's slow because it's not mandatory. No, that isn't the issue. I think that it's a big logistical task. We've got lanes open for people at our state clinics. This really is, I don't regulate private aged care, and I think we demonstrated last year that sometimes we're not the best people to tell them what to do because they don't always listen to people from the state government. Sometimes that has tragic outcomes. It is a federal system, and it's not a matter of avoiding any responsibility, but it's regulated and funded, accredited, policed, if you like, by the federal government. I've made these points to the Prime Minister. He knows my position on this. We'll help out if we can, but I don't like making rules that we're not going to enforce. And I'm not going to assume responsibility for a sector that I don't fund, that I don't regulate, and that some of whom last year indicated that they weren't prepared to listen to, well, anybody really, let alone somebody from a government they don't have any relationship with.
If we're nowhere close to getting that 80% vaccination target in private aged care, what does that say for the general community? Given that
these are staff, I just stress. We're not talking about residents. That's well and truly advanced.
We're talking about in terms of the motivation for the average Victorian to come forward and get vaccinated.
I'd be a little more positive than that, Mark. I'd say that, look, there is a big job of work to be done in private aged care for staff, and we'll all work as hard as we can to get there. I'm just trying to make the point to you that some things are within the state government's control and some things aren't. We'll do as much as we can, but ultimately the federal government are the ones who regulate that sector, and public health order, there'll be a place for that, but there's also a place, I think, for the funder of that aged care to say, righto, your funding is dependent on getting all your staff through this program. And by the way, we know that that'll mean people are away from their shifts, so here's a replacement workforce. We know that there'll be a small number of people who don't feel particularly well when they get one dose or two. Nothing serious, but they're out of work for an afternoon, for instance. All of those sort of backfill issues, all of that, I don't have the capacity to do that. That's got to be done by the government who runs that sector, in partnership with the companies who profit from it and the other church and charitable institutions that have licences.
I think Professor Sutton earlier said that there was an investigation into playground transmission. Are you able to perhaps come back to us with a bit more information on the specifics of that?
I'm happy to pass that to him. I think he talked about two cases. One that's not quite stacked up. It's a theory, but it's not necessarily provable, or not yet anyway. And then a second case, which was, I believe, school-age kids who are essentially walking home together, and it would seem quite strongly, it would seem that the facts indicate that they've given it to each other. There's been transmission as part of that. Anything you want, any more information you want than that I can get you, I'm happy to forward that on.
In terms of exercise,
Jamila will make sure that we chase that up for you.
In terms of exercises, obviously...
She called last question a couple of maybe 20 minutes ago, but that's all right.
In terms of exercise, obviously it's a two-person limit.
Yes.
Would you look at letting households walk together, given that a family of five can sit on the couch together with no mask and watch a movie? Why can't they walk outside with a mask together?
Because we're trying to limit the number of people who gather together. We're trying to limit the number of people who meet up with others. And I know it's tough. I know playgrounds being being closed is not easy. Playgrounds being closed is not easy. I know that. We've got to end this. We've got to get this done. We've got to try and drive these cases down, and these are the things that will work because they're tough. Like, they matter. They're meaningful. They actually limit movement. We're not doing them for fun. We're not doing them because we have a hunch that they'll work. We're doing them because last year they worked, and this year they are absolutely necessary again. And again, it's not well, they're necessary to achieve what we all want, and that is to be out of this with a chance of being open and staying open, getting vaccinated, and saying goodbye to these lockdowns, these types of rules. The alternative is not being open and free and it's all over. The alternative is what's happening in Sydney, and what's going to happen in Sydney for not weeks but much longer than that.
Is the ban on households walking together essentially around enforcement, in that it's easier to see if there's a group of more than 2 people and no children?
I think all of our rules, Rachel, are a combination of, you know, what's practical, what's common sense, what can be enforced, and also what limits movement and limits gatherings. And I know that this will be particularly challenging for larger families, but, you know, we have, and again, it's not a sense of blame or lecturing people or any of that, but just being frank, we were seeing last weekend, and not just last weekend, but at other times, we were seeing, you know, the playground was pretty busy, and there's been a lot, no one's happy to close playgrounds, for instance, but there's also been a lot of photos been circulating the last couple of days, playgrounds that were very, very, very busy, and, you know, that's a natural thing in some respects. That's why they're closed, because we just can't have those sort of groups gathering at the moment. That'll just spread this virus. But you do the tough and hard things now, hopefully for a short period of time. We can get on top of this, we can get out of this, and then we're not locked in till Christmas like some other parts of our country may well be. That's not a good outcome.
Premier, what do you make of the attempt in the upper house to have sittings this week? I think it's failed. Do you have any comment?
You're better briefed on what's occurred in that august chamber than I am. I have never been someone who tries to interpret the affairs of that particular place. I'm not very good at it, so I'll leave it to others, namely the Leader of the Government in the Legislative Council, to answer any questions about what's occurred there today.
What do you make of some accusations that the government is trying to avoid scrutiny by closing Parliament?
I think we set a record, didn't we, yesterday? 2 hours. I say that not necessarily tempting you all to set new records each day. I don't know how long I've been standing here this morning. I'll answer all your questions. I always have. If people want to call that hiding and avoiding scrutiny, I don't think that stands up to scrutiny, that claim. I think that's just a silly game from people who have time for such things, because they're irrelevant to the work that we're all doing.
Just about every other white-collar workplace in Victoria has managed to find a way to do the work that they usually do from home. Yep. Even federal parliament has managed to sit with some members elsewhere.
Yes.
Why can't you guys find a way of making parliament sit?
Yeah, it's a very good question, and it would be, I think, an even better question if I was standing here saying that we won't do everything we can to make up the days that we've lost. We will do that. We will try and make up any days that we lose to the best of our efforts. In terms of remote, we've had some members participating remotely. I think there are some legal issues about whether we have the power as a parliament to make laws if we're not all physically in the precinct, as is well defined under Acts of the Victorian Parliament. I'm sure that the presiding officers and the clerks and others are looking at those matters. I'm sure you'll forgive me if I say to you that online sittings is not necessarily right at the top of my list. It's not unimportant though, and I would assume that the people who run the Parliament, as opposed to the people who run the government, are looking at those things. That'd be a good thing, I think, not just for pandemic, but it might make all sorts of things possible.
I just invite you to comment on the EPA being investigated by the Ombudsman in regards to the Westgate Tunnel.
The Ombudsman has very broad powers, has a very strong budget, has a determination and a willingness to do her job, and I'd be confident that she will.
Does it at all affect the process moving forward?
I don't believe so, no. We have a contract, not with the EPA is not part of that contract. We have a contract with Transurban. We expect they get on and deliver this project, and there are some legal matters at the moment that we're working through, but they're totally they're in terms of contract terms. That's not related to what's been announced today, but that's at arm's length from the government. We have no involvement in that. I'd expect that it would be conducted properly. I'd be absolutely certain it will be.
Are we expecting a business support announcement tomorrow?
I don't want to commit absolutely to tomorrow, because when I leave here I'll get an update on where the work on that is up to. It's well advanced. The Treasurer and Minister for Industry Support they've been working very hard on this overnight, and again this morning I was exchanging some texts with them just before I came here. So as soon as we can, I do note that this was not due to come off till Thursday, so we've got a little bit of time. But I do appreciate that the sooner we can give people certainty about what further support is coming, the better that'll be. And then, of course, we've got to get the checks out there, and the good news is that so many of these grants have been paid, but the auto-pay function where people don't have to reapply has been a real success. That's the feedback I get from businesses large and small, many of whom ring me and talk about these things.
For people that did apply for that second round, they've applied over 2 weeks ago now. They still haven't heard back to see if they're eligible or not. What's your
I'm
advice
sure
to
that the Minister with responsibility for those matters can speak to that and any other issues when he stands before you quite soon and makes further announcements. And I do look forward to the Commonwealth Government being a partner in that, just as they have been the last couple of times. I want to thank the PM for the very positive way in which we've been working together. And I have no reason to think that we won't be able to have another joint funding announcement soon.
Earlier it was mentioned 50 children under the age of 10 have the virus, which is quite a lot. Do we know if they have mild reaction? Or
I'm happy to get a further breakdown for you. That's under 10. Then there was a bunch of teenagers had it too. There was quite a significant number, but we haven't seen that before. So if you just think about that for a moment. So we've got 50 kids that have got it. No parent wants their child to get this. There's all sorts of stuff coming out of the, very well-respected medical journals about long COVID and all sorts of different things. So no one wants to get this, particularly kids. We just don't want kids to get it. So when you think about that, 50 cases that are kids and advice and a decision to close playgrounds, that kind of makes sense. Doesn't make it easy, but it makes sense. And if you think about it in those terms, they're the difficult decisions that we make. They're based on advice. They're based on what worked last year. And they're based on an absolute determination to get these numbers down, to get us open, to keep us open. We've all got a part to play in that, all of us. And that's why, if there's no other...
Very quickly, there was a child...
I'll do my appeal to test at the end of this then.
In ICU.
Yes.
Can we just clarify whether that child is in ICU only because of COVID or whether there are other conditions at play?
I can't. I don't think anybody's ever... asserted that the only thing that might be... I genuinely don't know whether there's other issues. There could be. I think that tragically there's a family in Sydney planning a funeral of a 15-year-old. I think COVID was a factor. There were other things. But there are lots of other people that have been in hospital and have passed away and they didn't have underlying conditions. They were younger and they were perfectly fit and healthy. If it's not going to be a fundamental breach of that person's privacy, I'm more than happy to chase it up for you, and what we can give you, we will, Rachel.
And just quickly, we understand that the Victorian government has okayed a hotel quarantine transfer for a man from Adelaide to Victoria to say goodbye to his dying mother, but he's got that answer from Victoria but not from South Australia. I recognise that you're not the Premier of South Australia, but what are the communications like?
I'll take this opportunity to say lovely things about South Australia. Terrific place. Just trying to square up there for a few things I said a while ago. I didn't mean it at the time, of course.
Between us and other states to make sure that these requests can then be fast-tracked?
Yeah, sure. Can I say, I wasn't aware that we had approved from our end, but if we've done that, that's good. That just shows you that these are not decisions made by us. You don't want politicians making those decisions, and we don't here, and they don't in South Australia or any part of the country. I'm happy to chase it up for you. If we've given our approval, I'd be certain that the South Australian government would move to do that as quickly as possible as well, so that we can not just approve a compassionate trip, but make that happen. That's what we all want to see, where it's safe to do so.
One really quick one.
Sure.
Sorry. So may I put to you the lower number of vaccines administered in the western suburbs compared to the rest of Victoria?
Yep.
And you spoke about how it's a younger cohort over on average.
Part of it, I think.
Yeah. There's been some analysis done, and the age demographic is not significantly. It's marginal and doesn't really explain the drop off. Is there consideration being given to targeting that area? Are you thinking about long term what you might need to do to get that level up?
Well, the country's only drive-throughs out in Melton. I'm going to make further announcements about further drive-throughs, one of which will be in the west. We've got a number of clinics out there. If we have to open more, we will. But I just again make the point, we're part of this program. GPs and pharmacists who we work closely with, but they work to the Commonwealth. Who's involved in the program and where, they're not decisions that I make. I can stand here and speak at length, and if I can't, I can get the answers for you offline about what's going on in state clinics. As far as what's happening in Commonwealth-funded, regulated and organised primary care and community pharmacy, I can't speak to that. If we all have to do more in different parts of Melbourne, different parts of the country, then we will. Everyone's working together as closely as they can. And my challenge at the moment, I think it's well understood, it's not that we can't get the jabs done. We don't have the stuff. We don't have enough vaccine. Supply is the biggest limiting factor. That hopefully, if everyone meets all the targets they've set themselves, we'll see big shipments during September, and we'll be able to see a really big increase in the number of people who get the jab. But in the meantime, there are 300,000 appointments. Go online, book one of them. Turn up, get your first dose, then your second. And the other thing, if I can finish on this, please go and get tested, no matter where you are, if you've got any symptoms whatsoever, and please don't delay. That's our way out of this in the short term. Vaccination is the way out of this long term. It's about filling in that gap, hopefully with an economy and a community that's open rather than one that's shut down. If that's all, thank you so much. See you again soon.